As a nurse manager, making sure that patients receive safe, high-quality care is one of our top priorities. Nursing is a very difficult job these days, so as a nurse manager, anything I can do to improve a nurse's workflow is also a top priority. I was very interested in the sensible care system when I first heard about it because it addresses both of these problems. We have been using the sensible care system for 10 months on a clinical trial, and the results have actually been amazing. Sensible care system allows us to learn more about our patients' behavior, which in turn allows us to provide better care for them. Current fall prevention measures lack accuracy. Most of them are set up so that any movement sets off an alarm. So what happens is a patient moves at all and the alarm goes off. These alarms tend to be loud and startling to the patients, and there's no way to tell exactly where the alarm's coming from. So a nurse hears an alarm and has to stop for a minute and say, okay, which room is that? The sensible care system sends information to the nurse's mobile device as well as to a monitor and dashboard which is on the nurse's desk. This tells the nurse exactly which room the alarm is coming from. So the nurse knows immediately which room to go to. Not only that, but whoever is closest to that room is able to go in and prevent the potential fall. So that is one of the parts of the technology of the sensible care system that has been a great asset to us. Possibly the best part of the sensible care system is the fact that you can customize it for each patient. So if you have a patient who really doesn't move too much, you may set up the system so that it only alarms if the patient is actually sitting on the side of the bed. For another patient who maybe moves a little faster, you might set the alarm when the patient actually sits up in bed. For another patient who happens to be very quick, you might set the alarm to go off when they really make any movement. So you can customize it for each patient. This allows us to decrease the number of alarms that are heard. This is important for many reasons. One, nurse burnout is a very serious issue these days. It's often caused by alarm fatigue. There are many alarms that go off on nursing units. Some are the bed alarms, some are telemetry alarms, it might be a PCA machine, but a lot of alarms go off and nurses can be desensitized by them because there are just so many of them. By decreasing the number of alarms, sensible care has helped with the alarm fatigue, which helps with burnout, which actually decreases a nurse's stress load. So sensible care has helped in many, many ways. As I mentioned before, the current systems that are out there have very loud, rather annoying alarms, and there have been patients who have actually refused the alarm system because they're startled and bothered by the noise. We can avoid that with the sensible care system.